As far as safety of this, you're talking about light. People get a little bit scared because you're saying penetrating the skull,
Yes.
impacting the brain. These are all things that people fear a little bit about. What is the safety? Are there any side effects or precautions anyone should know about?
Well, everybody's different as far as patients and how things go. And in our several years of working with this, there's only been a handful of patients where, typically I come from, kind of this idea of not more is better, but, I think people can handle this technology at a higher level of power. And so one of the helmets that we're using has, 4 different settings, from say 25%, 50%, 75%, and 100%. And I would say, a good 2/3 of individuals, would have no problem at starting using the technology at 100% of power.
Mhm.
With that said, though, we do have people, we've had who had some severe brain injuries, not to the point where they're unable to walk, but severe enough that they're still suffering many years later, where we have to start out at a very low level on them. And even the amount of time, a typical would be a half hour, say for your first patient, where in these patients, we're talking about maybe 15 minutes. Or letting them say, we're going to start this treatment. And if you feel anything negative, like at any point in time, let us know, we're going to stop, and find our way to, ease a patient into this. So I would say more sensitivity, but with that said, when we've had to stop a few treatments on some patients, I haven't seen anything perpetuate something going forward where it caused a problem for the patient. We stopped the treatment, what they were experiencing went away, and that was the end of them for that day for that treatment.
Right. It was more of an acute reaction sort of
Acute
thing,
reaction.
blood flow, something happening there. Yeah.
Seen nothing lingering.
Yeah.
I'm not saying it can't happen because I don't like absolutes.
Sure.
They don't.
Yeah.
And they can certainly happen. But the large studies they've done, like looking at big groups of people treated, the side effect profile is extremely, extremely low. So it's a very, very safe treatment. And the biggest thing too with this, we're using infrared light. And with that said, people need to realize if you buy one of these devices, you're not going to sit and stare at it.
Yes.
Because it's not good for your eyes.
No. And you don't see that light,
You can't see it. You can barely see it.
Yes.
And it can be strong.
Yeah.
So that's probably the biggest concern is people, harming their eyes. And the way these devices are made, you're not having it. It's not covering your eyes. It's, up and above, or it's on it's a different setup where it's on the head.
Yes.
But, those are things that people need to consider. And, clearly, and you can even wear glasses that can protect your eyes from infrared light, with on a regular basis. That would be smart. But with the helmets, it's pretty encased. So I'd say it's very safe.
Yeah, no, it's the bike helmet thing. You'd have to be completely wearing it wrong for it to be shining your eyes or attempting to do that. And it was the interesting case because you're not going to see, it's going to look like a dull light almost with these diodes or, on the Weber and different, of course, ones. But I never knew this till I was at the ISLA conference that if you take a picture with a phone, it picks up, right? It sees the infrared that our eyes do. So you see all these shining, diodes and the real infrared light looks like a purple one there.